helping make your life easier. Moms every day.
Well, good afternoon. Thanks for joining us. We have Dr. Khawaja with us today from Cabell Huntington Hospital with a lot of useful information. Now, you deal with a lot of patients who have COPD.
Correct.
What is COPD?
COPD actually is an umbrella disease. It stands for Chronic Obstructive Pulmonary Disease, and it's a disease mostly smokers get, and other diseases that come under this umbrella can be chronic bronchitis, emphysema, sometimes bronchiectasis, chronic asthmatic bronchitis. All these conditions are lump summed as under COPD, which basically 90-95% of the smokers are patients who are smokers who tend to develop COPD.
All right, and that's a high number of people that are smokers that do end up coming down with this. What are some of the risk factors of the disease?
The most common risk factor obviously is the smoking, and there are some other risk factors, for example, exposure to any dust, and in our state, coal dust happens to be one of the other risk factors. People who have been working at the mines, being exposed to coal dust, can develop similar type of changes in their lungs. There is a genetic predisposition where people are deficient in an enzyme that can lead them to COPD. That number can be somewhere between 1 to 5% of the people who have COPD.
But overall, I think it's safe to say that it holds a strong prominence in our community, COPD does.
Well, part of the reason is the smoking prevalence. We are actually a little bit above the average from the nation in terms of the smoking. In addition to that, exposure to coal dust and stuff, a combination of the two, I think that's what makes us more prone to develop COPD in our patient population.
But how do we know that we have COPD?
Well, that's a very interesting question, because sometimes patients may not have any symptoms initially. They may have some slight cough, maybe a little bit of a productive phlegm. They can attribute to a little asthma, may have a little bronchitis and stuff like that. The most definitive test to really prove if you have COPD is by doing a spirometry or a lung function testing.
Oh, okay.
And because sometimes people's lung function may not drop till by about 50% before they become very symptomatic. And the trick there is an early recognition of COPD by doing surveillance spirometries in a selected number of people who may be smokers and above the age of 40, who may or may not be symptomatic at the time, but an early detection is always beneficial.
So it's pretty much just people who go on their own time to say, hey, check my lungs. Not even necessarily feeling, I just feel awful, okay, the doctor checks you out.
Correct, or even the questionnaires sometimes when they go to their primary care physicians and they give the history of smoking, and as I said, they may or may not have any symptoms till their lung function are really way down. I think an early detection with but just a simple spirometry can give valuable information as to whether there are early signs of COPD, because stopping smoking is probably one of the best prevention you can have.
Okay, so it's important to be open with your doctor if you're a smoker or not, because they're going to be able to give you more information.
Exactly.
But all that being said, what are the treatments for it?
Well, the best treatment you can do to yourself is stop smoking, because
of course.
If you can stop smoking, your lung functions can improve by about 30% in about 3 months. So just by smoking, stopping smoking can help you regain some of the lung function. There are medications available that can help improve the lung function. Unfortunately, COPD is a disease that tends to damage the lungs permanently. So there is really no medicine available that will reverse the lung functions or regenerate your lungs, but the medications we have available can help improve your lung function.
So I guess there isn't really a cure for COPD. Once you get it, you can just kind of improve. You can't go it all the way
Correct,
down.
and I think that's why you're absolutely right, and I think that's why an early recognition, early treatment, early prevention of smoking, I think those are the best things to do.
Okay, and how do we avoid hospitalization if there are no symptoms?
Well, most of these people will have symptoms when they affect a infection. Most of the times they come up with a viral infection, especially these winter months. They will come up with a viral infection or bacterial infection, and they start having more wheezing, more shortness of breath, and that lends them into the hospital. But again, there are smoking cessation probably is the number one resource there that can help them prevent further hospitalizations.
Well, all right, you heard it here. So just quit smoking while you're ahead now to prevent something like this from happening. If you need any more info, head to our website, wsaz.com. You click on that Moms Everyday tab. You can rewatch the interview. And then we also have Thankful Families coming up here on November 14th from 11 until noon. So you want to tune in for that one. Thanks for joining us. I'll see you tomorrow.